Fever is a common symptom that can cause a lot of worry, especially in parents of young children. The sight of a child flushed with heat, lying listlessly in bed, can be deeply unsettling. Parents often rush to check their child's temperature, hoping for a sign that the fever is breaking. But what exactly is a fever, and why does it happen? However, it's important to remember that fever itself is not the enemy. In fact, it's a crucial part of our body's defense system. When we understand the role of fever, we can better appreciate its purpose and manage it more effectively. It's actually a natural and essential defense mechanism our bodies employ to fight off infections and illnesses. When pathogens like viruses or bacteria invade our body, our immune system springs into action. White blood cells, the soldiers of our immune system, begin to attack these invaders. Think of it as your body's internal alarm system, signaling that something is amiss. This alarm system is finely tuned to detect even the slightest hint of trouble. When it goes off, it sets in motion a series of responses designed to protect us. At the heart of this intricate system lies the hypothalamus, a small region in the brain that acts as our body's thermostat. The hypothalamus is incredibly sensitive and can detect changes in the body's internal environment. The hypothalamus is responsible for maintaining a stable internal temperature, typically around 98.6 degrees Fahrenheit, or 37 degrees Celsius. This stable temperature is crucial for the proper functioning of our enzymes and metabolic processes. When our immune system detects an intruder such as a virus or bacteria, it releases chemicals called pyrogens into the bloodstream. These pyrogens are like messengers, alerting the hypothalamus to the presence of an infection. These pyrogens travel to the hypothalamus, triggering it to raise the body's temperature set point. This is why we experience a rise in body temperature when we have a fever. This in turn sets off a cascade of physiological responses designed to eliminate the threat. The higher temperature makes it more difficult for many pathogens to survive and multiply, giving our immune system a better chance to fight off the infection. In essence, fever is a sign that our body is actively engaged in battle, working tirelessly to restore balance and health. It's a clear indication that our immune system is functioning as it should, mobilizing all available resources to combat the invaders. While fever is generally beneficial, it's crucial to monitor it closely and seek medical attention when necessary. Persistent high fever, especially in young children, the elderly, or individuals with compromised immune systems, can be a sign of a more serious condition that requires medical intervention. Understanding the intricacies of this natural defense mechanism empowers us to make informed decisions about our health and well-being. By recognizing fever as a friend rather than a foe, we can approach it with a sense of calm and confidence, knowing that our body is doing its best to protect us. So the next time you or a loved one experiences a fever, remember that it's a sign of your body's resilience and strength, a testament to the incredible capabilities of the human immune system. Fever is a non-specific symptom, meaning it can be caused by a wide array of factors. It is the body's natural response to various conditions, often signaling that something is amiss. While a fever itself is not an illness, it is a symptom that can indicate the presence of an underlying issue that needs attention. Infections, both viral and bacterial, are the most common culprits. Viruses and bacteria are microscopic organisms that can invade the body and disrupt normal functions. When the immune system detects these invaders, it mounts a defense, which often includes raising the body's temperature to create an environment less hospitable to the pathogens. These invaders trigger the immune system, leading to the release of pyrogens and the subsequent rise in body temperature. Pyrogens are substances that can cause fever by acting on the hypothalamus, the part of the brain that regulates body temperature. This response is part of the body's effort to fight off the infection. Among the viral offenders, the common cold, influenza, and stomach flu are frequent culprits. These illnesses are highly contagious and can spread rapidly through communities, especially in close contact environments like schools and workplaces. Symptoms often include not just fever, but also fatigue, body aches, and respiratory issues. Bacterial infections such as strep throat, urinary tract infections, and ear infections can also send temperatures soaring. Unlike viral infections, bacterial infections can often be treated with antibiotics, which target and kill the bacteria causing the illness. However, it's important to use antibiotics responsibly to avoid antibiotic resistance. Beyond infections, inflammatory conditions like rheumatoid arthritis and inflammatory bowel disease can also trigger fever. These conditions involve the immune system attacking the body's own tissues, leading to chronic inflammation. This persistent inflammation can cause a range of symptoms, including fever, pain, and swelling. These conditions involve chronic inflammation, which can activate the immune system and lead to an increase in body temperature. Managing these diseases often requires a combination of medications, lifestyle changes, and regular medical care to control inflammation and prevent flare-ups. Certain medications such as antibiotics and anticonvulsants can also cause drug-induced fever. This type of fever occurs when the body's temperature regulation is disrupted by the medication. It's a rare but important side effect to be aware of, as it can sometimes be mistaken for an infection or other illness. This type of fever is not caused by infection or inflammation, but rather by the drug itself interfering with the body's temperature regulation. If you suspect a medication is causing a fever, it's important to consult with a healthcare provider to determine the best course of action, which may include adjusting the dosage or switching to a different medication. Identifying the underlying cause of fever is crucial for determining the appropriate course of treatment. This often involves a thorough medical history, physical examination, and sometimes additional tests, such as blood work or imaging studies. The goal is to pinpoint the exact cause of the fever so that targeted treatment can be provided. Consulting a healthcare professional is essential for accurate diagnosis and management. They can provide guidance on how to manage symptoms, when to seek further medical attention, and how to prevent future episodes. Remember, while a fever can be uncomfortable, it is often a sign that the body is working to heal itself. Proper medical care can help ensure that the underlying cause is addressed and that you recover as quickly as possible. When fever strikes, our body launches a multifaceted defense strategy to combat the underlying cause. This complex response involves both heat production and heat conservation mechanisms. One way our body generates heat is through shivering. This involuntary muscle contraction generates heat as a byproduct, helping to raise the body temperature to the new set point established by the hypothalamus. Another mechanism involves constricting blood vessels near the skin's surface. This vasoconstriction reduces heat loss through the skin, conserving heat within the body's core. As the body temperature rises, we may experience chills, a feeling of coldness despite the body's internal temperature being elevated. This sensation arises from the discrepancy between the body's core temperature and the temperature of the skin, which is cooler due to vasoconstriction. These physiological responses, while uncomfortable, are essential for creating an inhospitable environment for pathogens. The elevated temperature helps to slow down the replication of viruses and bacteria, giving the immune system an advantage in fighting off the infection. These responses are crucial for our survival and recovery. The elevated temperature helps to slow down the replication of viruses and bacteria, giving the immune system an advantage in fighting off the infection. Fever often announces its arrival with a telltale set of symptoms, signaling that our body is hard at work battling an underlying condition. It's a natural response, a defense mechanism that our body employs to fight off infections, whether they are caused by bacteria, viruses, or other pathogens. Understanding these symptoms can help us respond more effectively and take the necessary steps to support our recovery. One of the most obvious signs is a rise in body temperature, typically above the normal range of 98.6 degrees Fahrenheit, or 37 degrees Celsius. This increase in temperature is the body's way of creating an environment that is less favorable for the invading pathogens. It's a clear signal that something is amiss, and that our immune system is actively working to restore balance. This can be accompanied by chills, sweating, headache, muscle aches, and fatigue. These symptoms are not just random, they are part of the body's complex response to infection. Chills and shivering occur as the body attempts to raise its core temperature, while sweating helps to cool it down once the fever breaks. Headaches and muscle aches are often the result of the body's inflammatory response, which releases chemicals that can cause pain and discomfort. Loss of appetite and decreased energy levels are also common, as the body conserves energy for the immune system to combat the infection or inflammation. When we're sick, our body prioritizes its resources, directing energy towards fighting off the illness rather than digesting food. This is why we often feel tired and have little desire to eat when we have a fever. In some cases, fever may also lead to dehydration as the body loses fluids through sweating. Staying hydrated is crucial during this time, as fluids help to regulate body temperature and support overall bodily functions. Drinking water, herbal teas, and clear broths can help replenish lost fluids and keep the body functioning optimally. Children in particular may exhibit additional symptoms, such as irritability, fussiness, and sleep disturbances. Their bodies are still developing, and they may not be able to communicate their discomfort as effectively as adults. It's important to be attentive to these signs and provide comfort and care to help them through the illness. It's crucial to monitor their symptoms closely and seek medical attention if they worsen or persist. Fever in children can sometimes indicate more serious conditions, and timely medical intervention can make a significant difference in their recovery. Parents should trust their instincts and consult healthcare professionals when in doubt. Recognizing fever's warning signs allows us to take appropriate measures, such as rest, hydration, and seeking medical attention when necessary. Rest is essential as it allows the body to focus its energy on healing. Hydration supports all bodily functions and helps to flush out toxins. Consulting with healthcare professionals ensures that we receive the right guidance and treatment. By paying attention to our body's signals, we can better support its natural healing process. Listening to our body, responding to its needs, and taking proactive steps can make a significant difference in how we recover from illness. Self-care, including proper nutrition, hydration, and rest, plays a vital role in supporting our immune system and overall health. Recognizing and understanding these symptoms empowers us to take control of our health and well-being.